I'm the outpatient surgery charge nurse, and what I do is come in the mornings and get the patients ready for surgery. We get their IV started and do a scrub or surgical prep, whatever needs to be done, and then get the patient off to surgery. When the patient comes back from surgery, we wake them up and give them something to drink, make sure they're not sick on their stomach, and get them pain medicines, things like that if they need it, and then send them home.
A surgical technician is responsible for the instrumentation, setting up what the doctor needs in order to do the case, and being able to anticipate what he needs during the case.
This is a female, so I've picked out two of the smaller sizes. Each little block has a different cut for it. This is the first piece that they'll make a cut off of.
On this case, I circulate. I also can scrub, or I can do recovery room. That's the beauty of being a registered nurse. We can do anything that we are needed to do in the operating room. On this case, I will be circulating. That means that I will be doing giving them whatever they need. I will be aware of the scrub techs, the doctor, and the anesthesia personnel.
Well, we're going to be doing a kind of combination of anesthesia. We'll give her a light sedation along with the spinal anesthetic. Light sedation will keep them comfy and sleepy during the surgery, while the spinal anesthetic will keep them anesthetized and pain-free during the surgery. It also has the advantage to keeping them pain-free afterward. So I've seen patients do very well with this kind of procedure.
So the patient actually feels nothing from about the waist all the way down to the toes, and they cannot move extremities either. And in conjunction with that, depending on how sleepy the patient wants to be throughout the surgery, we give them medications, hypnotics and narcotics and so forth, to keep them as sleepy as they want to be. Now, our case today, the patient, she notified me that she wanted to be completely out. She wanted to hear nothing or see nothing, so she was completely asleep, breathing on her own, but completely asleep.
It's our job to get the patient ready to go to the operating room, to make sure the chart's complete, that the necessary lab work and the orders that the doctor has put on the chart is carried out before they go to the operating room, and make sure the patient is surgically prepared and ready to go to surgery.
There'll be two technicians on this surgery. One will be on each side of the patient. I'll be pretty much assisting Dr. Phillips today. Monica will be running the table, passing the instrumentation. I'll basically be providing a lot of exposure. He has to have good exposure, otherwise he can't do the surgery that he needs to do. And I'll be helping keep the patient in the correct position for him.
Well, we have to check the patient beforehand. We interviewed her 2 days ago, went through all her medical history, get a physical examination, checked her medicine she's on, make sure she's taking the right medication, make sure she should not take, about her NPO, that she should, and basically relieve any kind of apprehension and anxiety. It's a big procedure. A lot of patients get a lot of apprehensive and anxious coming to us. So if someone talk to them and explain everything and they know what to expect and how they're going to do, they do very well. So
when I got into anesthesia, I just loved the fact that you have the power and the ability to put someone to sleep and someone to, open the belly or open the head or something, and they're awake and they're back to normal, and they had, besides the pain, they had no idea that anything happened to them. That's the most rewarding part, having patients tell you that, "Ooh, I didn't feel anything, I didn't know anything, and you did such a good job."
The benefit of being able to help somebody, or you're not doing the same thing every case. It's something new every day.
I've been a surgical tech for 12, going on 13 years. Yes, I like doing this. I like the surgery part. It's always changing, and you always learn as a surgical tech. Everything changes daily, new instrumentation, new procedures. So I like the fact that it's always ever-changing.
Well, actually, I was in the military for about 8 years. That's where I got the bulk of my ICU and surgical nursing training. And in the military, they introduce you to all facets of nursing. And after my rotation through anesthesia, I knew that this is where I wanted to be.
The field is wide open. There are so many things that you can do in nursing. It's unreal. They can go into nursing and just pick and choose. It's one of those things that I can't begin to tell you how many opportunities they have. And it's something that can never go automated. So they will always have a job.